Hello and welcome to Love for a Lifetime, an intervention approach for safer sex at all ages by Portia Clark, Maureen Gates, and Katie Willett. Our group chose to look at the Get Yourself Tested campaign. This program was developed in partnership with MTV, the Kaiser Family Foundation, and the Planned Parenthood Federation of America. The program uses social media and on-the-ground education and services to target those under 25 years. By collaborating with schools and health departments, they encourage dialogue about sexually transmitted diseases and testing and hold free testing events. Get Yourself Tested describes STD testing as an act of pride, not of shame. For more information about their services and where to get in contact, please visit it'syoursexlife.com or npin.cdc.gov/STD-awareness/GYT. In our research, we found that the goals of the program included providing STD education and prevention, increasing testing for sexually transmitted infections, and linking individuals to treatment options. The primary targeted health behavior is to get tested for infection. This behavior is important if progress is to be made in preventing the spread of STDs and to treat STIs when they are still treatable. The website for It's Your Sex Life states that 20 million new cases of STDs are diagnosed every year, and that nearly half of those cases are in young people aged 15 to 24. The targeted audience is young people, those under 25 years, with the main focus on college-age students where risky behaviors are prevalent. The primary theory used for creation of the program is the precaution adoption model, which is a stage model that explains the process of how people adopt precautions against a new risk. It's Your Sex Life was launched in 1997 with the Kaiser Family Foundation. Planned Parenthood partnered with the campaign in 2009 and expanded the program by adding Get Yourself Tested. For implementation, the program uses social media to provide resources, success stories, address misconception, and what steps to take. The program is ongoing through mass media and social media and has events in conjunction with local and state health departments to provide testing. Many of the materials used by social media campaign are found on Facebook at www.facebook.com/it'syoursexlife, on Twitter at twitter.com/it'syoursexlife, on Tumblr at mtvit'syoursexlife.tumblr.com, and on their own webpage, it'syoursexlife.com/STDs-testing-GYT #! The webpage is broken into several sections. These include how to talk to your partner, a live chat forum, facts on testing, HIV/AIDS, and condoms, FAQs on HPV, sex myths, and also provides advocacy avenues. Users can also text their zip code to GYT Now to find nearby STD testing centers. Samples of these materials include this poster that informs the audience that 1 in 2 sexually active young people get an STD by age 25, and that most won't know it. The other image in this slide shows that you can't tell someone has an STD by the way he or she looks. One of the messages of the campaign is that a person may have an STD and may not have obvious symptoms, and many simply do not know they are infected. These images on this slide include a small black and white logo for the Get Yourself Tested campaign, and 2 others that show messages of the campaign for condom use and a free event to get tested that was held at the University of Southern Florida. To evaluate the program, researchers look at the amount of people under the age of 25 who contracted a new STD or STI, the amount that were seeking testing, and the amount that were seeking treatment. Data was gathered from the Planned Parenthood, the CDC, and the Kaiser Family Foundation. For example, in New York, they collected data from 10 Planned Parenthoods locations to determine use of services. They found that testing rates had doubled during April, which is the STD Testing Awareness Month. The strengths of the program include that it is ongoing, Since its creation, they have continued to promote the program at clinics, on campuses, on television, and on the internet. Another is the organizational contribution and how it collaborates with multiple partners for cost sharing and resource delivery. They have gained support from a broad range of organizations, including the National Coalition of STD Directors, the American College Health Association, the American Social Health Association, and the National Chlamydia Coalition. Due to the vast use of different types of technology, how they leverage technology for dissemination of materials and messages has spread, in some evaluations, been shown to decrease pregnancy and increase testing rates. In addition to those strengths, they tailor their messages to catch the attention of targeted youth. In the above examples, they used popular neon coloring and imagery. The limitations of the program are that they only target young people. By reaching out specifically to those who are college age, they can create highly focused material with appeal to that audience, but also alienate other age groups. For example, they may be missing youth in high school or junior high who may be experimenting sexually. Using their sites and apps requires technical knowledge to navigate through online resources. And finally, as our group experienced firsthand, it could be difficult to get information about the program from staff.
So, after examining Get Yourself Tested, a vibrant and successful program created to engage youths, our group wondered, what about the older generation? In comparison to the many interventions that target youth and sexually transmitted diseases and infections such as with GYT, interventions that address the sexual health of our aging adult population are far less prevalent. Our group found that there are limited programs and campaigns that address this health concern during our research investigating the scope of currently existing programs. The current lack of available programming for this population seems like an exciting opportunity for our group to develop an intervention tailored to the needs of an older generation. The following slides will discuss our group's program and intervention, as well as discuss why there is a need for programs that address the unique concerns of our sexually active aging adult population. Our program's intervention is called Love for a Lifetime, which is a title that suggests that all generations should be provided with the education, knowledge, and resources to have safe sex. Some might assume that the older generation needs less education on STDs, but this is not the case. While older adults lack knowledge about STDs, they also face unique challenges. They are less likely to discuss their sexual health with their doctors, and likewise, doctors may be less likely to bring it up with their patients. There are more older adults who are dating again due to having been widowed or divorced, and due to lack of knowledge might be less likely to use protection. They also face the stigma experienced with STDs. Older Americans are also more likely to be diagnosed later in the course of their STD. Rates of STDs among those 50 years and older are increasing, and according to the CDC, people aged 55 and older account for 26% of the estimated 1.2 million people living with HIV in the U.S. In 2013, the CDC reported that there were an estimated 8,575 new HIV diagnoses in people over 50 years old, and 44% of these cases were in adults aged 50 to 54. Our program's goal is to improve the health status in those 50 years of age and older by providing sexually transmitted disease and infection education and increased testing. There are many long-term goals, which include increasing STD testing for our target audience, increasing the regular use of protection and contraception, and finding decreased incidence rates of STDs. Additional long-term goals include improving access to the healthcare system, increasing community utilization of clinical services, increasing the proportion of infected individuals who know they are infected, and increasing rates of medication-compliant individuals. Short-term goals include improved knowledge of health outcomes, improved knowledge of testing and treatment options, initiation of dialogue about STDs among at-risk individuals, and improving understanding of benefits and side effects of medications. Also, more short-term goals include using culturally specific and peer-led interventions and improving accessibility to treatment immediately after diagnosis. Outputs include clinical services for education, testing, and treatment of STDs, having print materials and easy-to-use online tools for learning about STD prevention, symptoms, and community resources, and having community classes that target specific at-risk audiences. So here on the next slide, you can see that Love for a Lifetime is designed to be conducted over the course of a 1-month time frame with a 1-hour class each week. Classes should be conducted in local community centers. The community center location can reduce travel time of participants, especially since seniors may not have the resources or the capacity to travel many miles from their homes to attend class. Community centers may also already be familiar locations for them and be gathering spots for activities they participate in. Classes are collaborative and led by both the local health department as well as by community partners that have a foundational knowledge of seniors and STDs. The community partners can also provide input on ensuring that there is a focus of being culturally specific in order to make sure information is presented in a respectful and personal manner. Having some peer-led groups can build trust between seniors who may otherwise be hesitant to discuss their sexual health and activity with professionals and strangers from outside agencies. Peers are recruited by the local health department and have already had their own prior experiences being treated for STDs and are trained in 2 classes which focus on developing trusting relationships with participants and leading peer groups. Classes are held in person, which helps to build rapport with the seniors, and social media is kept to a minimum, although there is a basic website where seniors can obtain more information on STDs, symptoms, community referral contact information, and simple tips for discussing STDs with a partner. Materials that are provided include condoms, printed brochures with large font that breaks down information in a clear and concise manner, and referral information on where seniors can go to obtain follow-up treatment, counseling, and medications. Now let's look at the next slides that will discuss what the 4 classes of the intervention look like. So the intervention is designed to be that 1-month program. There's an hour-long class once a week for 4 weeks. The first class focuses on STD and STI facts and symptoms. Local health department representatives dispel myths and also provide information on STD and STI symptoms for the seniors. A peer-led group discusses the role of condoms as protection from STDs and STIs and proper condom usage. Having a section of class led by a trained peer can help put the seniors at ease and encourage them to ask questions. The second class utilizes community partners to discuss where seniors can go to obtain testing and the types of testing, and discuss with the seniors the entire process of what getting tested is like. One of the trained peers shares their own personal experience of getting tested at a local test site so the participants can hear a first-hand account of what the process is like from start to finish. The third class discusses strategies of how to initiate communication with both doctors and partners regarding STDs and STIs. Seniors may feel embarrassed to bring up the topic with their doctors and are provided icebreakers on how to discuss their sexual health with medical providers. They are encouraged to view discussing sexual health as a routine part of their medical exam, in the same way they discuss other issues that they might be having. Also, being able to discuss STDs and STIs with a partner is focused on in a co-facilitated group with a peer facilitator and a representative from a community health agency. Fears of discussing sexual health with partners and how to initiate perhaps a difficult conversation are addressed, as well as the reasons why having open discussions among sexually active partners promotes safer sex. The fourth and final class discusses treatment options once a diagnosis is made and how to connect step by step with local community resources. Many seniors may be resistant to go to another doctor, especially if they already have multiple other doctors they are seeing for pre-existing health problems. By going in depth into the referral process, our program hopes to decrease anxieties and concerns, provide motivation into how seeking immediate medical assistance benefits them and their partner, and also allows them to obtain necessary treatments as soon as possible.
Consistency, we have based our program off of the pre-caution adoption model, similar to the Get Yourself Tested program. Each class we use tries to target one of the important aspects of the precaution adoption model and follows the natural progression of any adopted new health behavior. For class one, we focus on being unaware and being unengaged. The goal is to get the members participating in this program into being aware and engaged in deciding if they want to act on preventing STDs and STIs, and also if they would like to protect themselves and others from spreading the disease. Class 2 provides the tools you need to make that decision and to get you to say, I'm going to act or I'm not going to act in that protection. And Class 3 is more based on maintenance, getting you to connect with your resources, to speak with your doctor, to speak with a pharmacist or a community advisor, and find out what you can do to prevent it and get more education on progression. Lastly, class 4 is about acting. It's giving you the tools on where to go for treatment, where to go for testing, where to go for more information and brochures, etc. For us to measure our outcomes, we are going to utilize more community collaboration. We want to partner with the testing sites and the community centers to provide referrals to those participating in our program. The participants and the going to these sites would give that referral information, and we would be able to use that for tracking of the testing. We ultimately would like to see a 10 to 15% reduction in the spread of STDs and STIs in this targeted population. We also are looking for a higher percentage of testing in the 50 plus population. So by using these test sites, we're able to see with the referrals if we're getting a higher turnout than in previous research. Earlier diagnosis is really important as well, because that will help with the decreased spreading of the STD, and that's something we can get from the physicians that are partnered with our program or physicians that have to provide the information to a certain site where we can get that information as well. So how do we evaluate our outcomes? Safer Sex for All will be partnering with the local public health and community sites and create analysis and reports to test for statistically significant data for these types of programs and see if we are reducing the spread of disease and increasing medication adherence and providing sooner testing. Because the community sites will be providing pamphlets and resources, we will be able to see if the demand for these resources are higher. We also be evaluate by connecting directly with the participant at our program trainings and meetings and classes if this is something that is engaging them and this is something that they're taking outside, and we could do maybe before to get the information like class 1, and then also get that information again from them in a type of evaluation at the end of class 4. And limitations of safer sex at all ages. Some strengths in this program include that we're tailoring to a specific population. Historically, we have seen that sex education has been targeted towards the younger population, as we've seen with our Get Yourself Tested campaign in the previous part of this PowerPoint. We do provide a lot of resources that are specifically targeted to the older population. We want to try not to generalize any of the information and want to make it sure that they know that this is targeted toward them, so everything presented applies to this group. We do make sure that we present everything with a partnership with our communities and make sure we have a strong connection with the stakeholders, and then they're a part of the process, from beginning to end and any follow-up in the middle. We do make sure that this is locally done, so we want to have it done at a community-based center, maybe at churches, anywhere that is a high area for the community to go to. And everything that we do at our program is free of charge and free resources. So the goal is to maybe get past some of those barriers or monetary issues, or not being able to afford to be able to go to a class every week or be able to afford medication. We all partner with them to get them the resources that they need to be able to adhere to medication or adhere to getting tested as well. Of course, we have limitations with all of programs, and one of our major limitations is cultural beliefs. The knowledge and attitudes that this population has is really important, because it can create a barrier for us talking about some subjects that may be considered taboo in that community or that culture of people. There's some things that are considered don't ask, don't talk about it, and it's really hard to kind of take away some historical attitudes, especially when sex education was started so late in the 1900s. So it's really started when this group was already adults and they were already married. So it's really a limitation that we notice that we have. Accessibility to some of the workshops may be a barrier for a lot if you do not have a car, transportation, or the timing doesn't work. A lot of people won't be able to access this program or these classes. And then we do have a small barrier of cognitive abilities. Some people are going to be a little bit older or a little bit younger. They may understand the references or the health literacy. So we are definitely going to have that limitation when it comes to explaining the information and making sure that everyone's cognitively aware or just health literate on what we're teaching. Let's compare the Get Yourself Tested versus the Safer Sex for All Ages campaign. When we look at both campaigns, we can say that there are a few commonalities. One is that they do focus on the on-the-ground education and making sure that they're constantly interacting with the audience that they are targeting. They also both use the precaution adoption model, so we know their main goal is to move those from the unengaged, unaware stage to the engaged, aware, acting, and hopefully moving them into maintenance so they're able to continue these new health outcomes and health changes that they have learned in these programs. Both programs also stress the importance of acting in the sense of pride and not shame when it comes to STD testing, and almost empowering those to treat STD testing and education as a part of their normal health maintenance and not something that they should see as a taboo thing or something that they shouldn't feel comfortable with speaking to others about. Some of the differences in the campaign is that the Get Yourself Tested campaign really targets that 25 and under age group. Their primary goal is targeting that Generation Y, Generation X group. They utilize a lot of social media, and they really are targeting the lifestyle and the cultural phenomenons of the today world, while our program really does specifically target that population that's 50 years or older, so that has just as much of a wide range of people. We have the baby boomers, and then there's the older population, so we're really trying to target that group and give them a sense of empowerment. And we really looked at different programs and different things that worked better for that group. We looked at traditional learning styles and emphasizing on big picture concepts. And we know that for this population, health and wellness is a really important aspect for them. So we continue to make that part of the forefront of our campaign. On this slide, you will find the resources and references used to create our campaign, as well as the information for the Get Yourself Tested initiative. Thank you for taking the time to learn about our Safer Sex for All Ages campaign.